public service reform. How should we deliver better public services, essentially, is the question. The Public Services 2030 network is supported by 7 great organisations. I'm going to do my best to remember their names now. And we are working with the Centre for Public Impact, SIPFA, More Than a Provider, Reading Partnership, Policy at Manchester at the University of Manchester, the WEA and the Institute of Employability Professionals. I'm very happy I got through that, and we're very grateful for all of their support for these events. We couldn't put them on without their support. Tonight's event is co-curated with More Than a Provider, who are an organisation we'll hear more from about later on from Aisling. Bit of housekeeping. The event will run till 7:15 p.m. not AM. I will do my best to chair it so we are finished on time. You're more than welcome to stay for some more warm white wine and crisps afterwards. Fire exit through the thing that we call the cubby hole, basically that cupboard there. Toilet is to the right of the lift. Yeah, make yourselves at home, and hope you enjoy the event. So what we're talking about tonight, public service reform, is back on the agenda. We've just come back from, a couple of weeks ago, back from Labour and Conservative conferences. There's a lot of talk about reform. You hear it from Keir Starmer, you hear it from Wes Streeting. I'm sure we're going to hear maybe something on that tonight from Andrew. And obviously adult social care is a really important part of the reform conversation. Adult social care being the support that's provided to individuals in their adult lives to maintain independent, healthy lives. And we can talk probably about what the boundaries and margins of social care as well. I think it's fair to say that for more than 2 decades, the government has tried, and largely unsuccessfully, different governments have largely unsuccessfully tried to reform social care. I was going through a King's Fund timeline on social care funding reform this morning as I was prepping for this event, and it is a kind of staggering list of blunders, retreats, and often failure. So it's not the most cheery outlook. To make us feel a little bit more positive, though, I think it's interesting to point to some of the work, and we're going to hear more about Social Care Futures work, but there is a kind of growing momentum around a bold, positive vision for adult social care, and I know we'll hear from panelists tonight. So that's the context, that's what we're here to discuss, and the question in particular we're going to be talking about is how can the next government of any stripe, maybe one stripe in Andrew's mind, deliver a new vision for social care. And I'm delighted to welcome 4 really excellent speakers to discuss this topic with us. So to my left, we've got Andrew Gwynne. Andrew is the Shadow Minister for Social Care, appointed in September, is that right? Mm-hmm. And was previously the Shadow Public Health Minister. Anna Severwright, 2 down from me, is the convener for Social Care Future and was previously co-chair of the Coalition for Collaborative Care. To Anna's left, we have Richard Humphreys. Richard, I think, has many roles today. One of them is Senior Policy Advisor at the Health Foundation, previously led the King's Fund's work on social care and has a professional background as a social worker and has kind of held many senior roles in social care locally. And then to Andrew's left, we have Aisling Duffy. Aisling is the Chief Executive of Certitude. They're a charity supporting people with learning disabilities, autism and mental health needs. And she started a career as a support worker. So great panel, one I'm slightly in awe of, and I won't do too much talking. We want to hear from them. So I'm going to pass to Andrew for his take on the question we'll be discussing tonight. How can the next government deliver a new vision for social care?
Well, thank you very much, Ben, and it's my pleasure to be here. I guess I am the head of social care policy for the Labour Party at the moment. I've been in this job probably around 5 weeks since the reshuffle. I actually relish the opportunity to be the first social care minister in a new Labour government, hopefully sometime soon. And for me, having started out my political life many, many moons ago as a local councillor, and then representing my hometown in Parliament for, well, I'm in my 19th year now, I understand just how important good quality social care is, not just for the individual that's receiving those services, but also for their families, their support networks, and for society as a whole. And look, bluntly, social care, there's some great work going on out there, but there's also some incredible issues that need resolving by whoever forms the next government. There's a workforce challenge that we all know about, but also we've got a social care system that is too fragmented. There's a lot of talk about integration. There's some great examples of integration starting to work, but there's not enough of that. And there are issues with the NHS, and you can't fix social care in isolation without fixing the National Health Service, and you can't fix the National Health Service in isolation without fixing some of those issues in social care. And obviously delayed discharges are one of the issues, but not the only one that interrelates with the NHS. The question of how to fix social care, let alone make it fit for the future, is not an easy one. Wes gave me the task of setting out a 10-year programme of reform and renewal that will ultimately lead to a national care service. And people often ask, well, what does a national care service mean? And I'm very much at this starting point of the journey, thinking that a national care service can't be one big monolithic organisation like the NHS has become. It's not going to work if that's what we end up creating. Nor am I going to be a minister that will sit in some office in Whitehall pulling levers and then nothing happens and wondering why nothing happens. What I see a national care service becoming is the centre setting out the what, the expectations, the service that we would want anybody across the country to be able to access, the outcomes. It's going to be very outcome driven to try and remove the postcode lottery. National standards, not just on service, but also on workforce, how we treat the workforce, how we pay the workforce, and so on. The what is really important, but the how it's delivered cannot be dictated from the centre. So we set out some national expectations and we expect them to be delivered, but the how you deliver it has to be very much driven from the locality, and at its heart has to be the user of the services. And so I want to see services co-produced at a local level in genuine partnership. We've said we don't want another top-down reorganisation of the National Health Service. That means we will quite happily use the ICS-ICB model. We might have different expectations of the ICS and ICB model, and it may well be that there needs to be a stronger voice outside of the acute sector on the ICBs, because if we want to have, as laid out in Labour's health mission, a real shift from hospital to community, from analogue to digital, and from a system that fixes people when they're broken to one that prevents people from getting broken in the first place, that isn't just a mission for the NHS, it's for a mission for the NHS and social care. And that isn't going to work when you've got an over-dominance of the acute sector in the NHS. I think it's something like 90% of the spending goes to the acute sector, but 90% of the actual delivery of healthcare is outside of the acute sector. So we need to rebalance that, and we need to make sure there is a stronger voice for social care, there is a stronger voice for public health, and there is a stronger voice for community and primary care on the ICB, so we can get that shift out of hospital. We also need to work in partnership with hospital trusts, with the acute sector, to reimagine their purpose. Because if we're going to have that shift from hospital to community, we need to make sure that the Acute Trust reinvents itself as a provider of community services, as a provider of integrated care services, both in the community and in people's homes as well, wherever that's appropriate. And we see some work taking place in some acute trusts already, but there's not enough of that happening at the moment. On our 10-year plan, in terms of those national standards, I'm also very clear that we drive up the quality in some sectors of social care. Gone will be the days when some of these absolute shysters that charge the earth and deliver poor quality care, often funded by private equity businesses, will be allowed to operate in our social care system. We will give extra powers to the CQC to ensure there is proper financial transparency, that their taxes are paid and paid properly, that they pay decent wages, terms and conditions to their staff, and that the care quality is of a decent standard. If they can't meet those expectations, they will not get certified. That is one thing that we will shift. And then lastly, on workforce, one of the first things we've got to tackle are the huge shortages in the social care workforce, alongside the shortages in the NHS workforce. I'm very clear, as is Angela Rayner, as is Wes Streeting, that we have to make sure that the first fair pay agreement of the Labour government is for the social care workforce. But beyond that, I want to professionalise social care. I want to make it a profession that people want to go into, because they are caring people and caring for people, not because it's just a job and it pays a wage. So we need to make sure there's career progression. We need to make sure there is career fluidity between the NHS and social care in both directions. And we need to make sure that there is lifelong learning and training in social care, so that you can start at the bottom and work your way to the top. And I think if we achieve all of that in just some of the 10 years, we're well on our way to that national care service.
Thank you, Andrew. Round of applause, I think, for that. Anna, whenever you're ready.
So yeah, hi, thanks for having me. So I'm Anna Severwright, and I am one of the conveners of Social Care Future, but I'm also somebody myself that draws on social care for over 10 years now. Can't believe it. So I employ PAs in my home through social care. So as the name suggests, Social Care Future is looking forwards. We started 5 years ago. We had our 5th birthday last week. And we say we were born out of frustration, but powered by hope. We're an unfunded movement, and we were just a group of people who got together and said, actually, we want to see something different. What could that look like? Let's start trying to make that happen. Because at the time, most of the things that were coming out of the sector were sort of just talking about the crisis and how hard everything is. And I'm not trying to say that it hasn't been extremely hard times in social care, and there are still a lot of challenges, but equally we weren't saying, but where do we want to get to? How could we change this? So that's kind of where we started 5 years ago. And one of the first things that we did was to co-produce a vision about social care, which some of you may have heard, some of you might not have done, but it's been taken up by lots of different organisations now. And last week we launched an animation of that vision. Too many words, sorry. Voiced by the lovely Liz Carr from Silent Witness fame, which we're just going to hear it now.
Cool. Hopefully this will work.
It's only short.
We all want to live in a place we own, with the people and things that we love, in communities where we look out for one another, doing the things that matter to us. But for many, this is not reality today. And without big changes to the way we think about social care, many more of us will face losing control over our lives and contact with the people and things that make our lives worthwhile. It doesn't have to be this way. At its best, social care helps us to find, grow, and weave together the people, places, and resources that we can draw upon to live where we choose, in the way that we want to, with meaning, purpose, and a sense of belonging at every age and stage of life. Realised through innovative approaches like circles of support, shared lives, and gig and sports buddies. We need this to be the reality everywhere and for everyone. To do this, our government needs to invest in social care, and our local councils must work with the people they serve so creative approaches can take root and begin to thrive. Let's start growing this social care future together. For all our futures, share this video and join our movement for change.
So the vision at the beginning of that, we all want to live in a place we call home, with the people and things that we love, in communities where we look out for one another, doing things that matter to us. That's what we say should be the vision for social care. But actually what's powerful about that vision is it's nothing to do with social care. It's actually what we would all want from our lives. And unfortunately, we know that a lot of people who do draw on social care have some of those fundamental choices taken away from them. But actually, that vision can talk to everyone about their lives. And I think the first thing I would say that I would want the next government to do would be to talk about social care in a really different way. Because actually, until we start talking about the why of the social care, and that it's actually about living good lives, it's about purpose, it's about the connections with the people that matter to you, then I think we lose a lot of the essence of social care. We can talk about, I don't want to just be washed and dressed and fed, actually, but then have nothing to go and do with my life. There has to be a reason to get out of bed in the morning. And actually, until social care is thinking about people and their lives in that context, and not just talking about putting people into a bed in a care home, but actually thinking this is a real person with a real life, with connections, and how are we going to maintain those things for people? So we did some research a few years ago around what the public think about social care, and they told us, it's in a crisis. They used a lot of words like looking after, and words that made people sound quite, the vulnerable and people that need to be cared for, and very passive, which is why we use people that draw on social care, because it implies that I'm making choices about that care and support. I'm not just being done to. And they also, a lot of them said about the NHS. And I think that is actually a real risk for us, especially at the moment. You hear in the news about social care, it will always be about getting people out of hospital. And actually, social care has an amazing role to play in its own right. And unless we keep talking about that role, we could get quite easily sort of subsumed into the sort of just we're only there to get people out of hospital. And actually, that's a really small part of social care. I think it's half the budget is on working age adults, a third of users are at working age, but even older age, we need to be doing the prevention that Andrew was talking about. So I actually think we need to kind of grasp social care and see it as an opportunity and start talking about it as such. I was on a podcast earlier with the Chief Executive of Skills for Care, and she mentioned social care now employs more men than it used to. It's 19% of the workforce. But that is actually more men that are employed by the entirety of the armed forces in the UK. And I just thought, crikey, this is social care is a massive part of the economic structure of this country. And it's an investment that we put into our society. And we need to be talking about it as a way of creating well-being, and not as a deficit model that it's only there to step in when something goes wrong. Actually, it's there to do some really important things for all of us. But I also think it's not just for the government to do or local authorities to do. It's actually for all of us to be doing. It was really encouraging to hear you mention co-production, Andrew. And I think people with lived experience do need to be at the heart of whatever the future of social care is. Part of the reason we had our first event 5 years ago was that there were all these conferences and events that would talk about social care and have nobody that drew on social care at them, either in the audience or speaking. And as I often say, if you held an event about women's rights and you didn't have any women there, you'd get absolutely crucified. But it was okay to be doing that about social care without any of us there. And actually, we have a lot of expertise, ideas, and experience that we can use to improve things. But also community, the wider community needs to be involved. You know, they are the experts of what their communities need. And I think from the language perspective, we've so often talked about the vulnerable, the elderly, and we sort of dehumanize and we separate and we imagine that it's for this thing over there. But actually, it is for all of us and it matters to all of us. You mentioned workforce, and I think that is a really important part of the future. But I think so often we've not just under-resourced social care, but we've under-imagined it. And even now, when we think about social care, people will default often to residential care and then maybe to domiciliary care agencies. But actually, I think for the future, the social care workforce needs to look different as well, because actually most people I know who perhaps in 20 years' time might need some social care are not wanting to go into those residential care homes that they see now. So we need to be looking at things like local area coordination, community circles. We need to be talking about a much more diverse workforce. PAs will be part of that, micro enterprises. You know, there's all these different things that we could have, some of which we might not even have thought of yet. But without that kind of imagination and looking at how we change things, I think we could struggle. So what I would want the next government to do would be to create a system that enabled areas to be innovative, enabled those small things that are out there. We call them glimpses of the future, like community circles or shared lives. How are those going to become more of an option for everyone? How are they going to spread and grow? But to allow that freedom, that creativity to flourish in local areas. It's not about doing to an area, it's about doing with. And I do want my personal assistants to be well paid. I actually pay a lot more than most agencies do. And I can do that because I don't have any shareholders or profits or any of that. But I guess I worry about the professionalization, because actually my best personal assistants have never worked in care before. And they're absolutely fantastic because they don't come to me wanting to look after me. They come to me wanting to just enable me to live an ordinary life. And so although I think they are highly skilled, and I would never argue that, and they need to be properly, fairly paid for what they do and recognised for what they do, I don't necessarily want them to go and do lots of training and get badges and be sort of part of a registered workforce, because actually they're wonderful as they are now, in my view. And then finally, I think it's about where the power lies. So I do want some more power to be with individuals and families, that people have genuine choice and control over their care, with their communities and with workers as well, actually, because so often I hear from people, they say, oh, we want to be doing this, but we're not allowed because this stops us. And one of the pieces of work we're just about to start is called plumbing and wiring. And we're working with local authorities to see about some of the bureaucracy and how we can cut some of that red tape. But it also does involve, I think, trusting individuals and trusting people that, you know, we know what's best for our lives. So I will finish where I started with hope. You know, I think it's a really important part of this discussion. It's about not seeing social care as a burden, but seeing it as an opportunity, an important part of our society. It's not about seeing a demographic time bomb or a burden, but actually what we all contribute to society. And it's about all of us as a society. It needs a proper investment, but we also need to spend that money in a different way. Thank you.
Anna. Thank you.
Richard. Yes, thanks. So this next 5 minutes is going to be really difficult for me, partly because I'm following Anna, who's always excellent, and I don't want to repeat what she said, but also because a year ago, I wrote 95,000 words on how to end the social care crisis, a new road to reform. And now I've got 5 minutes to summarise it. So beat that. I think fixing social care would be easier. But I just want to make three key points about what the next government could, and I believe should, do. The first point really stems from the fact that whoever forms the next government is going to inherit a dreadful state of affairs in terms of the economy, the public finances, and a whole range of public services that will be competing for what limited resources there might be available. So there are not going to be any immediate quick fixes or big checks for social care or anybody else, I suspect. But that doesn't mean to say that the next government can't come up with a good, ambitious, bold plan based on a clear vision along the lines that Anna has described, but a plan that is realistic about how long that will take and the resources that it will require. And there's a real opportunity here, I think, for the next government to learn from the mistakes of some of its predecessors who have consistently overestimated what can be done in the short term and underestimated what can be done in the long term. But undoubtedly, there will be some immediate pressure points that will need attention. And I'm sure Andrew is right that workforce is probably top of that list. So it's going to be dreadful, but let's not abandon our ambition and our vision for better social care. And let's be much more realistic than previous governments have done about how long that will take. And there are other advantages about that, taking that long-term approach, which I'll come on to. The second thing I think a new government should do is go about the process of reform in a completely different way. We've had 25 years of a whole range of green papers, white papers, and so on. Just grinding out another paper is not going to have any more success. And instead, I think the government should reach into the toolbox of co-production, of the various types of deliberative democracy, to really start a series of bottom-up local conversations about the value of good care, as Anna has described. The fact that most of us now actually will have some kind of care or support need at some point in our lives, and that this is a vital part of our economic and social infrastructure. It's just as universal a need as universal healthcare or education for our children. And my third point is then to build up that series of local conversations into a much broader understanding of a new social contract for care, a new framework that sets out the rights and the responsibilities, the benefits and the entitlements of citizens, of families, of local groups, of the state, of local authorities, of stakeholders, of providers. Kind of a really big conversation about the responsibilities we all share to really sort out social care. One of the mistakes that we have made in the past is simply to shout at the government of the day, you've got to sort this out, you've got to give us the solutions. And the government indeed does have some very important responsibilities, but it can't do all the heavy lifting on its own. So by a social contract for care, I suppose I really mean a kind of a Wigan deal on steroids, if those of you are familiar with a Wigan deal, but something like that, but scaled up dramatically from a series of local bottom-up conversations. In conclusion, I want to take us back to the 1940s, and I want you to imagine that when somebody had come up with the idea of a universal healthcare system, that instead of implementing it, we'd dithered and we delayed and we prevaricated for the next 25 years. And we'd entered the 1970s without the NHS that we know today. And instead, we'd probably have ended up with some kind of North American insurance system, I would imagine. Despite all the siren voices saying that universal healthcare was not affordable, that there were higher priorities, the government of the day went ahead and did it in 1948. And it did it because it was elected to do so on the back of overwhelming public support for universal healthcare, free at the point of need, and indeed the other pillars of the welfare state. And that, I think, is the courage and the commitment that we need from the next government to set out a really good, ambitious long-term plan and to buy us time to build up that public support and understanding of why social care is so important, so it becomes on a par with the NHS in the public's view, and therefore it then becomes much easier, or should I say less difficult, to have the tough conversations about how we pay for it. Thank you very much.
Thank you.
There is an enormous opportunity for a new government to make a really significant impact on the lives of people drawing on social care by tapping into the huge breadth of real world experience, knowledge and advice of people drawing on social care and their supporters and advocates. I'm delighted to be here tonight representing More Than a Provider, which is a collaboration of 6 not-for-profit providers who share the ambition of making the social care future vision that Anna shared with us a reality. We came together because we share experiences and a commitment to work beyond the boundaries of our services and contracts and make it our mission to support whole communities to thrive. We bring decades of experience and support, over 11,000 young people and adults with learning disabilities, autistic people and people with mental health needs, and in often many cases, their families too. People who are often described as working age and who are likely to have a lifelong need for flexible support to meet their needs, their hopes and their aspirations. And we know firsthand the difference great support at every stage of life can make to people's lives. But far too often, the social care debate does not reflect these younger people, and their voice is left out of decision making. We call on this to change with a commitment by a new government to realise the future vision for social care alongside local citizens who draw on support, their families and supporters. So it's genuinely co-produced and co-designed. And we are lined up to actively support this via our connections with local people and communities. Turning to the point everyone has made about workforce, really, across the More Than a Provider collective, we employ 17,000 people in a whole variety of different roles, from some of the roles that you described, Anna, community connectors, personal assistants, shared lives, support workers. And in fact, I think that's often misunderstood. There are more people employed in social care than by the NHS. Skilled and talented colleagues doing really varied and interesting roles who are hugely committed to the difference they're making to people's lives. We already prioritise training and development opportunities and offer apprenticeships and other qualifications. So the critical issue for new government is really pay and supply. As a minimum, we are calling for pay parity with the NHS and for the Fair Pay Agreement to include a funding settlement for local authorities that will ensure a properly and fairly paid workforce. We see this as an investment, not a cost. We can also help address the issue of supply. We offer meaningful and exciting employment opportunities, offering apprenticeships and other development opportunities for young people who may be leaving education and don't want to pursue an academic career and struggle to find a career pathway. Or indeed, people at a later stage in their life looking for something different, often in their local area. So actively recruiting people without previous social care experience, which you've referred to, Anna, as they bring fresh thinking, offer life experiences and often an openness to learning. The Labour Party have recognised the opportunity to create lots of green jobs as we transition to managing climate change. And we need to see the same opportunity in creating jobs in social care as we adapt to the demographic changes. Turning to the money, the expected spending for young people and working age adults with learning disability or autism is expected to double to over 18 billion over the next 20 years. And while of course there is a case for additional investment, there is an even bigger case for doing things differently. So many of our contracts are for time and task and not driven by the outcomes that will make a real impact on the lives of people and local communities that draw on resources outside of traditional support. And while we can see various examples and are part of really good collaborations and partnership working, fortunately, very few providers experience local authority commissioning as driving innovation. Capacity within local authorities to think and to co-design with local citizens and providers has been driven out, largely leaving procurement as the option, where too often people's lives are treated as commodities and sold to the lowest bidder. Not-for-profit providers are well positioned to provide and to work at pace to maximise and streamline the various budgets and evidence the impact of an outcome and values-based approach to commissioning. A new government could consider a dedicated community innovation incubator for social care and for prevention. More than a provider, organisations have the scale, the capabilities, and indeed the motivation to be early adopters to test and evidence the impact of new ways of commissioning. There are already many good examples, such as alliance contracting and others, which we could look to replicate. We need a whole system approach, one that recognises the interdependencies between all the departments, including welfare, education, housing, and of course health, all of which contribute to equalities and the outcomes that matter to people and communities. And we really welcome the greater role for the voluntary sector within ICBs, as you referenced, Andrew. It will take brave and innovative approaches to make the changes needed. We as a society need to do better, and there is no doubt we need our government to do better too. We are absolutely lined up to help.
Thank you, Ashley. So I'll just abuse the chair's privilege and ask a couple of questions, and then we'll open it up to the floor. So get ready to put your hand in the air, but not just yet. I wanted to talk about visions. I mean, I think, Anna, what you said about the kind of impetus for setting up Social Care Future is just so inspiring, and I think it's something which so many other policy areas that we work on here and that I've worked on really lack. So I think, yeah, and you know, politicians, think tanks, media are so often kind of drawn to the day-to-day crisis. Having taken a step back and thought, what's a positive vision for the future, I just think is really admirable, and I think for other policy areas, there's loads to learn from that. What I want to ask you though is, do you think people agree with your vision, or do you think there is some debate on the vision? And I'd be interested in panelist reflections, and maybe Andrew's kind of reflections on whether or not Social Care Future's vision is something the Labour Party would be interested in endorsing. But Anna, do you think do you think we can kind of agree on the vision and get on with delivering that, or do you think there's still a debate to be had on the vision?
So I've not heard. I think initially when we started talking about the vision, the most of the kind of, if I got any kickback, it was usually that it was just very unrealistic and completely impractical and kind of could never be achieved. And so that often seemed to be the kind of sticking point for some people. I've not had anybody say to me, I don't want those things in my life. Sure, some people might word it in a slightly different way, or there might be other things that, you know, in someone's life. So I suppose, you know, I'm not, if someone wants to come up with a better vision, I suppose it's more about actually what the vision represents and just having something that we can say, really, it was about saying that there's a difference here. So often in kind of the green papers and things, they'll say there's a vision, but the vision will be for safe, proportionate, like timely care. And that's not a vision. That's the means to an end. So I suppose what we wanted to do was to say, well, what's the point of social care? And to really put it out and challenge that. And also then to be able to say to the wider public, this is something that you should want to support, not just something that you don't really want to think about because you dread you might need it in 50 years' time. So I suppose it was about, you know, we looked at things like the equal rights to marriage and the mental health time to change. You know, we looked at other social campaigns and how they'd done it to try and learn from them. But I mean, we've done this with no real funding, so we're not experts in it. And if someone wants to come up with a better one, then fair enough. But yeah.
Thanks. It's just useful to know that. And Andrew, is it something you think the Labour Party should be learning from, endorsing, trying to deliver on if they're in government?
I mean, look, that video said it all. And who wouldn't want a social care system working in that way, because it isn't about services on their own. It isn't about even the level of care somebody gets. It's actually at the heart of it is a person being able to live their lives independently and in a fulfilling way, and wanting to enjoy life to the full without any barriers being put in the way. The state has no right to say, no, you can't do that. No, you shouldn't aspire to that. No, you shouldn't have hopes and dreams because we're going to crush them. It's human nature to want the very best out of life, whoever you are. And, you know, I believe in equality of opportunity, not equality of outcome. I can't promise that everybody's going to be a millionaire tomorrow and live the jet set lifestyle, but everybody is good at something. And it is the role of the state to find out what that something is and to allow them to flourish and to dream their dreams, and if they can live their dreams, to enable them to live them as well, whoever they are. And I always say that to children when I go and visit schools in my constituency: don't be afraid to dream your dreams, and if you get the chance to live them, take those opportunities. Some people need more opportunities than others. Some people need more help to reach those opportunities than others, and that's what I see of a national care service. Should be an enabler to allow people to live fulfilling lives, and lives in a dignified way, not treated as a unit, but treated as a person that requires whatever it is they require. But also, why I'm so passionate about co-production is these things can't be allowed to happen to people. Really, you know, there's this mantra, no decision about me without me, but actually that shouldn't be a mantra. It should be the norm. And it shouldn't be done in a silo way. It should be done in a holistic way. So we are looking at everything, not just the day-to-day care needs, but the education needs, the wider society needs of that individual should play part and parcel of the services that are designed to allow them to live their lives in a fulfilling way. So that's a long way of saying, yes, I support very much the vision, Anna.
Ashley, do you want to come in?
I mean, I think it speaks to home, it speaks to love, it speaks to purpose. What is not, you know, that's important to each and every one of us. And there's something about how we make it real and make the conversations about social care about real people and real lives. So I think the fact it was co-produced and co-developed, I think it's hard to beat.
One of my colleagues who's here today, Tricia, she's come up with the phrase gloriously ordinary lives, and her organisation is called that. And I think that's such a brilliant phrase, because actually it is, sometimes it is, you know, I just want to be able to go to Tesco's and get my shopping like everyone else can.
You really don't.
But, well, when you can't do it though, suddenly you do actually, you know, value having the choice of going to Tesco's. But equally, I want to be able to, I don't know, fall in love or go on holiday. So there's sometimes it is about mundane things, but actually those are important too. But it is that both aspects of life that just make up your ordinary life. And I talk about in lockdown, the first lockdown, suddenly feeling like I was part more of society than I'd felt in ages, because everybody was experiencing restriction on those basic, just normal things that people take for granted, and experiencing a bit more of what I experienced. And I think, to somehow be able to change that would be really good.
Richard, do you have thoughts on the vision? Yeah?
Well, I don't think vision is the problem.
No.
Yeah.
Social care has never had a problem with producing visions. It's never had to go to Specsavers to get its vision. The problem is implementing it and actually changing the way the money works and changing the behaviours of commissioners, so that commissioners are not spending a small fortune, thousands of pounds a week, on having people with learning disability in secure accommodation miles away from their homes and families. And how do we reverse the trend whereby the last few years the NHS has been spending a bigger proportion of its budget on acute care rather than services that help people to manage their illnesses and stay well in their own homes? It's those big shifts of money and behaviour that is the problem. It's not the vision.
But Yeah, no, I would agree with that. Also, would you agree, Richard, that we haven't been ambitious enough in the how care can be reimagined, how social care can be delivered? So we may have, over the past, been able to develop good visions. I'm not sure we've ever been as ambitious as
No,
we need
no,
to
we haven't.
be.
But I think we need a combination of ambition
Mm.
about outcomes and a grip on the levers to make that vision happen. And it's the grip bit that simply has not worked. And hence we now have this kind of rising tide of demand for traditional kind of health and social care that is outrunning our capacity to develop the alternatives that are better, give people better outcomes, and in the long run are probably cheaper. And it's how we break into that vicious cycle, and prevention is one of the buzzwords at the minute. And again, we talked about that for decades. I can dig you out green papers on prevention 30 years old. We're still talking about it. Sorry, I'm trying to inject a bit of...
If I can jump in on the prevention issue, because I actually do think this is the key. And in Labour's health mission, the one thing that got largely overlooked, because most people don't actually know what it means, other than those of us that are health geeks, but we have committed to making England a marmot nation. Now, that means it's the work of Professor Sir Michael Marmot on social determinants of health. And he rightly says, as has been already discussed, that health policy can't just sit in the Department for Health and Social Care. Our health and well-being is decided on a whole range of public policy from cradle to grave. It literally is everything that is decided at a national level or at a local level that impacts on our health outcomes and on our well-being from, well, even before birth. You know, some of the pre and postnatal services for mums, then it's family support, it's early years, the first 1,000 days of the child, it's our housing, it's the environment, the air we breathe, whether we've got good recreation, leisure facilities, it's the education, training, skills agenda, it's employment, it's public transport, because if the jobs aren't where you live, then you've got to get to them. It's good services in the community, including social services in its most broad sense. And by that, I mean having lots of good activities for people to do, and right the way through to social care proper and end of life. We all deserve a quality end of life. And all of that is the responsibility of, in large parts anyway, departments that aren't anything to do with health. Making England a marmot nation is actually part of that. And, you know, we've given two specific pledges. One is that we will increase life expectancy again by the second term of a Labour government. But that isn't ambitious enough. You can live to 100, but if 60 years of that you're in abject pain and misery, it's not much of an achievement. So we will also increase healthy life expectancy. Tackling those social determinants of health, those ingrained health inequalities, is crucial. And it's crucial for social care going forwards, because we prevent other people from needing some of the services that there is incredible pressure on. But it's also about making sure that people are able to live those fulfilling lives as well.
Thank you. That was a really interesting set of reflections. I just wanted to pick up, before I open up to the floor, something on National Care Service. Obviously, we heard about kind of sketching of Labour's vision for that. I'm just interested in kind of panelists' reflections other than Andrew, and then maybe we'll come back to Andrew to respond. Do you kind of welcome Labour's talk of a National Care Service? Something I find slightly confusing sometimes is, you know, National Care Service sounds kind of like National Health Service, but we don't want it to be like the National Health Service. So just interested in kind of the other panelists' reflections on It's not, I mean, it's been floating around Labour circles for a very, very long time. But yeah, reflections on National Care Service, distraction or useful lodestar. Anyone want to kick us off?
I think useful. I think really important that we're not trying to recreate a National Health Service in the lines with what you are, the National Care Service in line with the National Health Service. I think the strength of the social care sector is its diversity, is the range of different offers that are available to people. You mentioned from micro enterprises to shared lives to the range of supported housing, the variety of different providers in this room and beyond. So really important that we're enabling very locally designed, flexible, person-centered arrangements that really work for that local group of people, that local community, but that there's the framework that provides the kind of overarching set of expectations, guidance, how we hold those local authorities to account on the delivery of some of that, the co-production, as we referenced, which is so critically important to local design, that actually there's a real genuine requirement for how that happens. So I think setting some of those standards around employment without, I think I would also agree, without overly professionalizing. Actually, it's about how do we really make sure that we are enabling people to develop really fabulous careers within social care, but maybe wouldn't obviously see that as the stepping stone for them. So I think as a framework really helpful, as long as we maintain the diversity and the flexibility of local support and local provision.
Thanks, Ashley. Alan, do you recommend?
I mean, when National Care Service was first being kind of floated around as a kind of like, we need a National Care Service sort of to have parity with the NHS, I think I was quite a few people were quite nervous because it was like the sort of sense of we don't want an NHS. And so I was really, I'm very pleased with the direction it's going and the sort of outcomes framework, rather than a sense of this is an organisation that's going to deliver social care. So I think that's a much better way of doing it. I suppose, we have a Care Act at the moment that actually has some quite good stuff in it, but isn't being delivered. Yeah. And I don't think anyone would pretend it even remotely is. And so, we sort of also know a lot of the outcomes. They've been being redeveloped over the years many, many times. So I guess at some point, a bit like what Richard was saying, it's like we've got to go beyond the kind of this is what we want the outcomes to be to, and now this is how we're going to enable local authorities and communities to make it happen. But I like that structure rather than
I thought there were some interesting ideas in the Fabian's report, actually, and a lot there worthy of merit. And in some ways, for me, the most important bit in it was when it said, actually, it doesn't matter what we call this. It doesn't matter if we call it a National Care Service. And for me, that term gets in the way. Yeah. It implies you can get a tin of sort of verbal spray paint and spray over our creaking social care system and call it a National Care Service, and it will conjure up warm feelings about, it's going to be like the NHS. Well, it isn't, unless something big changes. So I'm kind of cautiously optimistic about the contents of the Fabian report, and in particular the encouragement given, I think, to the not-for-profit sector. But let's not get hung up on what we call it, and let's not kind of get sort of overawed by that expression.
Cool, thank you. Right, we've got 20 minutes for questions, so please put your hand in the air if you'd like to ask one. We'll take two at a time. If you could say your name and what organisation, if any, you're from. So we had Ali in the front here, Dan just down here, and then we'll take the gentleman to the right as well.
Hi, I'm Ali, Head of Public Affairs at United Response, which is one of the 6 organisations that's part of More Than a Provider. Andrew, you talked about the responsibility of the various different departments in prevention. So how will you ensure that a potential Labour government gets all departments to make a commitment to delivering the Social Care Futures vision a reality?
Thanks, Ali. And gentleman to the right.
Nice, easy.
Thank you. My name's Jack. I'm from LSE, and this is like to all the panel. Given the overstretched local authority budgets at the moment, where authorities are issuing like Section 114 notices, and all of the financial problems that they have, how do we encourage and enable local authorities to develop new social care strategies and improve services in the future?
Okay, so question number one from Ali: how can a Labour government put into practice the social care future vision? Question number two from Jack, talking about the F word, funding, which I've managed to avoid grilling Andrew on for this whole time. But essentially, local authorities are in financial turmoil. How does improving social care happen against that backdrop? Andrew, you're the MP. I'm going to pick on you. So yeah, do you want to come in on either of those?
Yeah, I can come in briefly on both. So, Ali, in terms of how we get all government departments signed up to the health mission, it's very clear. We have said that at the heart of government, there will be a health mission delivery board that will ensure that the social determinants of health are embedded in all public policy. I suppose the easiest way of describing it is almost like a requirement that is imposed on all ministers under the Equalities Act 2010, under the Human Rights Act 1998. Ministers have to certify that their legislation is and policies are compliant with those laws. We should be asking a very basic question: does this piece of legislation, does this policy improve the health and well-being of the citizen? Quite frankly, if the answer's no to that question, why the heck are we doing it? But having that that mission delivery board focusing on it, ensuring all government departments are playing their part towards what essentially I liken to a national health and wellbeing strategy, will tie that together. And Keir is very clear when some of the shadow ministers say, well, I've not had a mission, you know, there were 5 missions, I've not had a mission. He says, you have got a mission. The health mission is each and every one of your missions, so make it happen. And that's what we will do. Jack, in terms of local government finance and how we get those service improvements, look, integration's the only game in town here. And we've got to get much smarter at procuring jointly, basically treating the NHS and social care budgets as a single pot, smart commissioning, smart service delivery. In some areas that's happening anyway. In my own area, because of what was happening on the ground, the clinical commissioning group was essentially taken over by the local authority anyway. So the chief executive became the chief operating officer of the CCG. And that allowed the hospital, the council and the CCG to effectively pool their budgets and to start procuring out of a single pot. It also enabled them to merge their workforces. And so you got rid of some of the duplication. So, for example, if you needed a medical bed in home, you would have one set of assessors going out from the local authority. You'd have one set of assessors going out from the hospital, assessing 2 bits of the same equipment. Now you just have one going out, assessing whether you need the bed and just procuring it. It's a simple example, but having a single budget and a single vision really is a game changer in my local authority area. We just need to get more of that happening.
And just to add to that, John, I think there's a real opportunity for local authorities to work differently with not-for-profit providers in their local area. You know, many of us have been working in very close partnership over many years and actually understand the local community and the needs quite well. So there's a real potential to actually contract differently with us, looking at a more outcomes, values-based approach over a longer period of time. What we often see is local authorities in desperate situations ending up going down a procurement route, and actually it's a race to the bottom and people lose out, and actually you don't necessarily achieve the financial return that you may have been intending. So I think we can offer something to help.
Yeah, I think. Oh, sorry.
Go on.
On the Jack's question, I think where we as Social Care Future plan to try and contribute and help is that, you know, we've shown that when you show the vision to the public, we did some research, that actually it does make them more positive about social care, and it does make them more say that they would be more willing to, you know, pay more tax for social care. Now, obviously, that's, you know, needs to be looked at more deeply, but I think we're hoping to start using that animation, but also a much broader kind of attempt at getting out to the wider public that actually social care is a much bigger thing than they think it is. It's not just the wrinkly hands pictures, it's not just care homes, and that actually, because MPs tell me they don't get letters about social care, they get letters about potholes, they get letters about maybe the NHS, but they don't get, and so the political pressure isn't there, and actually we are going to have to spend a bit more on social care, but I also think we need to stop spending it on things like putting people with learning disabilities in long-term placements for years miles away from home. And actually, or, you know, when I said I wanted to be able to get out more with to see my friends, said, oh, we can refer you to our befriending scheme. So they're spending money on things that people don't want. And you know, so there are things we can save money on, but I also think we do need some more of it, and we need to spend it on things that people do actually want and that promote health.
Okay, so local government finances are in a mess, and one of the big reasons for that is that over the last few years, the government has shifted the burden of funding from central government to local governments, and now, you know, councils are having to support this huge slice of expenditure that cancels out everything else. So there's a big problem there to be fixed. But I think one of the things we've got to do as part of fixing it is to make sure that councils have got a little bit of financial headroom to innovate, not to put all the money into what they've always done and mainstream, but, you know, to find new ways of meeting people's needs, to experiment, to innovate. Anyone remember the Better Care Fund? I mean, it originally started out as something called the Integration Transformation Fund, and the idea was to kind of you know, stimulate that sort of innovation. It got hijacked in the course of hospital discharge, so that opportunity was lost. And I think this can be done. If you look at the quite large amounts of money the government has dribbled away into social care over the last few years, but in last minute, short term, hand to mouth, almost panicky initiatives, instead of putting all that money together and planning sensibly with it and saying to local providers and councils and stakeholders and people that use social care, what's the best way you could use this 2 million quid in your area? Instead, it's been, here's a slug of money, you've got to spend it in 2 months' time, you've got to tell us exactly what you're doing with it, and it can only be spent on these things. That's the last way you want to use extra money in social care. There you go. There's your answer.
Right, we'll take a few more questions from the floor. Oh, you got some from the screen. Oh wow. Sounds like anyway. Hannah, do you want to do some from the? We've got an online audience as well. I should have announced.
We do. The chat is, as the kids may say, popping off.
Oh really?
Lots of comments. But really, the questions coming out of it are, again, about funding, and directed at you, Andrew, unfortunately for you. Basically, exactly. So basically about what kind of funding commitments Labour's going to make on this, and a question about, you know, Richard talked about the new government inheriting a difficult financial position. In that context, what can be done about prevention that you talked about?
So was the question one, what funding commitments is Labour going to make on social care? Quite a hard one to ask at this stage, but anyway. And then the second one was essentially, if there's no money, how do we do prevention? Okay, 2 easy ones, Andrew.
So
people have spoken.
So given that this is being webcast and probably Rachel Reeves is online, I've got to be careful what I say. Look, we've not made any funding commitments as yet on social care. We recognise that as far as I say, the whole health and social care picture is concerned, that we need to stabilise the NHS. We need to ensure that the workforce challenges both in the NHS and in social care are tackled. And we are committed to a workforce strategy. We were talking about it long before the government created their own version of it. And we are committed to that, and there is funding for that workforce strategy. There is also funding for driving down the waiting lists in the NHS, and for the commitment that we made on dentistry. But beyond that, we've not made any further funding commitments. Now, as we approach the general election, we are going to have to do some work on how we are going to fund social care going forwards. That work is in progress, but we've not made any announcements yet. In terms of how we embed prevention, that is all about how we shift priorities in the health and care system. In part, you do that by giving prevention a much stronger voice on the ICBs. As I said in my opening contribution, 90% of the funding of an ICB goes to the acute trust in one form or another, but around 90% of the actual care provided in the same ICS area isn't in the hospital. So we need to address that imbalance, and by then shifting the focus of the hospital trust into integrated care provision in the community, in shifting the focus on better primary care and community care, you start to tackle some of those health inequalities. Plus, it's not, as I've already said, just for the Department for Health and Social Care. You start to drive down those real inequalities by having proper joined up government, both at a national level, but also at a local level. And councils are actually better at doing this already than national government, because councils have had to have a health and wellbeing board. Councils have had to have a health and wellbeing strategy. And some of the best local authorities in the country are really using their health and wellbeing strategies to focus all council policy into addressing health inequalities. And that's precisely what we need to do at a national level. Yes, it will cost money, but that money doesn't just land on the Department for Health and Social Care. In actual fact, some of the savings will be a benefit to the Health and Social Care Department, which we can then reinvest in health and care services.
So I don't think anyone else needs to do the Labour funding commitments question, thankfully. But anything on the thoughts around a pivot to prevention in a tough financial environment? Richard, do you want to kick us off?
Yeah, sure. But can I just come back to that point though? Because I think any opposition party would be crazy to make specific funding commitments about social care in the run up to an election, for the simple reason that its opponents would immediately weaponize that and use it against them, and that's why politicians in government are terrified of social care. They think it's a vote loser. They think it's toxic. It's too difficult to do, and this is crazy. I mean, this is one of the big reasons why we've struggled with it for 25 years, and we've got to turn that around. And giving ammunition to your opponents in that way is not tactically sensible in my view. So I'm very, very pleased actually when I heard that Labour were not going to make specific funding commitments. But that doesn't mean to say we have to compromise the ambition. No. That's the key point. On prevention, I think we've got to figure out some new levers to change the way the money works, and I think Demos has come up with some ideas.
We have indeed
about that.
plug. PDEL, so, that's going to solve all the world's problems.
And locally, I think we do need to try and find this kind of some kind of headroom locally to do something along those lines. Because otherwise, we're just going to be spending more money on the same stuff that doesn't actually work that well and actually costs more in the long run. And it's and maybe one practical thing that would help is a proper 3-year funding settlement for local government, so they could plan ahead. So there are things that you can do even within the existing financial envelope that would be way better than what we've seen in the last few years, which is a lot of money dissipated, frankly, on short-termism.
Yeah. And I think there's a real opportunity to work much more at place on and collaborating more broadly than with the usual partners to really make prevention key and relevant to the issues in that local area.
Anna, do you want
I'll be very quick.
Yeah.
I think too often we focus not on prevention because it's harder to measure, and the system love a metric. If I sit in another meeting talk about metrics. So I think we need to stop valuing busyness and seeing activity as productive, and actually saying, whatever the government asks from ICBs, how we're going to prove, we need to be measuring things like well-being and different things to stop the system feeling like it just needs to be doing things to be productive. I do think for a short term, in the long term, this should save us money. And in the short term, we still have to plug all the issues that we have now because we haven't been doing prevention and start the prevention. And that's almost like a double whammy for a few years. And that's, I think, an issue that we probably need an honest conversation about. And for me, locally, as somebody with lots and lots and lots of complicated health issues and teams and people involved, the amount of times somebody says, we can't do that because that's their job, that's their money, their budget. PA can't collect a prescription because, it's bonkers. So if everybody involved in my health and social care saw themselves as just part of a team that was there for my well-being and not as part of, then that would make life so much easier. And I think might save money, but that's easier said than done. It's all very easy for me to say that, but the system is very, very complicated and needs some change.
Cool. We've got bound. We've got a round of applause.
There you go.
We've got a couple of minutes left. I feel there are lots of hands still, so we're going to take 3 very, very quick questions, and then we'll ask panelists to sort of reflect and, provide any concluding remarks. So we've taken loads from the front, so we're going to go one over there on the left. We're going to go to, Patrick in the middle over there. Sorry, Mr. Person at the front, and to Patrick's left as well. 1, 2, 3. Yeah,
thank you. Hi, my name's Amy. I'm from the disability charity Leonard Cheshire. 2 questions, because one's a clarification. You talk about a workforce strategy, and just to confirm, that's a workforce strategy for social care as well as healthcare, because frustratingly, we have the situation now of the NHS being taken precedent with the current government. I can see a nod, so I know that's a yes. And the second question is just about the ambition within the Fabian report on the fair pay agreement. And the proposal within the report at the moment is to, as soon as possible, have pay parity with the lowest rung of the NHS. And that kind of creates a picture that social care workforce, which, as we've heard, is bigger than the NHS, is one group, is the lowest rung. It frames them in a way that doesn't recognise that broad spectrum that the social care workforce is. And it feels like a very low ambition. So I'd love to hear your views on that. Thank you.
Thank you. So question there on ambition around the fair pay agreement proposals in the Fabian report. Patrick.
Hi, I'm Patrick Hall from the University of Birmingham. Just a quick question on the really exciting topic of means test changes. We've been living with the same kind of means test for almost 20 years now. Previous attempts to reform the means test have come a cropper for various reasons, including political polarization, as Richard pointed out. How can a new government design a reform program around something like that to avoid the pitfalls of previous attempts?
Thank you, Patrick. Patrick's left.
Hi, I'm Trisha Nichol. I'm from Social Care Future and Gloriously Ordinary Lives. And it's kind of a gauntlet and a question all in one, I guess, to Andrew, and an offer of help as well. One of the kind of things that Social Care Future we talk about is changing the narrative, changing the story of social care. And there's lots. One of the things that worries me is when we keep talking about prevention and we keep talking about the language of workforce and we keep segmenting it up. And what Anna described so beautifully there was how things need to work so that she can get to have a life, to have her gloriously ordinary life. And so I guess my slight gauntlet and challenge is that how can the Labour government take that, really commit to that narrative that doesn't get sucked in to this concept that prevention's something different from the other stuff that we do. It's everything to do with this thing we call social care, that we're just changing how we think about it. It's not, there's this thing called prevention, and then there's the getting up in the morning, and they're mutually exclusive. So that would be my, it's a slight gauntlet and an offer of support.
Cool. So 3 questions there. A gauntlet, an offer of support around language from Social Care Future. Question on means testing, and a question on ambition and fair pay agreements. Does anyone want to kick us off? This is probably the last chance to say anything. So also, is there anything you want to get off your chest?
Try to with the means testing question.
Yeah.
I've consistently supported the Dilmore proposals for a cap on how much people should have to pay as a maximum. It strikes me that in a civilized society, it is eminently reasonable for the state to put a limit on people's exposure to those costs, and it's an iniquity that doesn't happen. That doesn't solve all of the social care funding problems, of course it doesn't, but it's a very modest step, and I think that ought to be part of a package of wider reform.
Thank you.
If I can just pick up the pay parity with the NHS, I think it should be at an absolute minimum being that standard. I think the reality is we have an enormously diverse, talented, skilled workforce in social care, and we don't need to be shoehorned into a kind of agenda for change equivalent. I think there needs to be the opportunity for that flexibility, and that needs to be reflected in the fair work agreement.
Anna, anything in response to those questions, and we'll finish off.
I mean, I'll go with the language one. I think we love jargon, and I think we are better in social care than the NHS. I will say that. I used to work in the NHS and they love jargon, but we still have it. You know, we talk about prevention, we talk about activities, just all these phrases. And actually what we're talking about here is people living a life and keeping people well. And I think actually if we can start talking about that in policy and seeing that not as like dumbed down language, but just as the language, because it's what everyone understands, then actually maybe also like you might get more support from the public for things like the Marmot thing. If, you know, it's called something that they understand and how it impacts their life. And maybe that's a way forward for not just social care, but the wider world. There you go. That's my
Andrew,
final point.
Final from you.
Well, firstly, to confirm to Amy, yes, the workforce strategy absolutely has to include social care. Otherwise, we're not going to fix some of the issues. The fair pay agreement, the Fabian's report is, you know, really interesting. It's full of some great ideas. It's not necessarily how we're going to approach it. We did ask the Fabians to produce that report, and it's kick-started a debate, and there's some great things in there. But in terms of the fair pay agreement, look, we're working very closely with Angela Rayner because we have to get this right, because it is the first one of a number of fair pay agreements that we want to see. And the fact that we've committed to social care being the first one is in part down to Angela Rayner being a former product of having worked in the social care sector, and she's very passionate about it, but also she's very clear we've got to get that right. So Patrick, in terms of the means test and how we get that into the reform agenda without falling into the pitfalls. Look, I've been in this job for 5 weeks, but you know, I absolutely understand where previous governments have fallen flat. There are some fantastic ideas out there. As Richard says, we don't need any more white papers, green papers, mission statements, because they're all there written down. If you've got any advice or anybody else as to how to avoid some of the pitfalls of the past, I am all ears. And then Tricia, I'm very, very happy to welcome any help, including help on language. I completely get what you're saying about how do you commit to the vision and sell that vision without getting sucked into the different aspects of it, because people automatically switch off. the problem with being a politician is if I go on the politics show tomorrow and say, this is the vision for social care and isn't it great? The first question I'll get back is, well, how are you going to do it? There's 150,000 people, vacancies in the social care workforce. How are you going to do it? And it's very difficult to say how you're going to do it without saying we're going to have a workforce plan. Long-term illnesses and so on. How are you going to do it? And you've got to go on to the prevention agenda. How we get that language more human, though, is really crucial. And I'm more than prepared to work with you guys so that we can get the language human and voter proof. But most importantly for me, who will have to sell it not just to real people but to journalists, how we get it journalist proof as well.
Seems a good note to end on. Thank you so much. Let's join in a round of applause for Stay for a drink if you want to. Thank you.
I don't envy him.